Hello, welcome to Yummy Talks. We are having this exclusive podcast from MedEdge MEA. Joining with me is Dr. Osama. We are at the second EHS International Critical Care and Organ Donation and Transplant Conference. Tell us more about yourself, Dr. Osama.
Hi, it's my pleasure to be with you. I'm Dr. Osama Salama. I'm emergency specialist in Al Qasmi Hospital, and as well I'm a trainer for life support courses and by AHA American Heart Association and ERC European Research Council.
That's great to hear, actually. What you have presented during this particular congress, what we are having today.
Basically, what we have done that we are looking for the out of hospital cardiac arrest, the patient who have cardiac arrest outside the hospital, and how is the management that have done for these patients, and the result of these patients' outcome. So basically, we look for the international benchmarks and the international analysis for a lot of study from everywhere in the world. And we come across a recent study from the region in the GCC area. And we saw that usually the result in the area is lower than the international standard. So we want to benchmark ourselves, and we were expecting that we will find ourselves in the same region of the GCC area and the result from the GCC area. But what's surprising us that we found that we have a much higher survival rate and compare with the standard of the GCC area, and we are reaching the benchmark of the international standard. With the survival rate of the out-of-hospital cardiac arrest, we have 6.7% of these patients survive to discharge out from the hospital. The international standard is between 5 to 10%, and the GCC area is actually around less than 3%. So that's telling us that we have actually done very good job in compare with what we have was expected.
Okay. What does this actually survival number mean in terms of medical terminology? Or is it based on the success rate what we have during the surgeries?
Basically, that's what we are looking for is the patient who have cardiac arrest. They have stop of their cardiac respiratory and they require chest compression out of the hospital. Not they did not have the cardiac arrest while they are in the hospital. They have it while they are outside the hospital. And then will tell us how the paramedics works, how is the hospital emergency department work, and how is the intensive care unit works. The whole system is looking for the outcome of around the whole system, how that's working. Because how many of these patients survive to go back to the community? And God forbidden, you have an event of cardiac arrest, you have stopped your heart, and there is no heart beating, the life actually stopped. And to survive and go back to the community, this is a very, very huge task. And as I mentioned earlier, the international standard is 5 to 10% of these people will go back to the community. We approach 6.7%, which is actually a very great outcome.
Okay.
As what we be.
When you say about this numbers, do you think it was recently the achievement has been done to that mark, or it has been improving since years from the advancement in medical field, particularly in GCC countries?
It's a very nice question, actually. It's very good. This is actually our study. We done it retrospectively on 2024. But this study, when we saw these numbers, initially we were actually surprised. We go to check our numbers 3 times to be sure that the numbers is accurate. And we are really watching this because we don't want to say anything which is not accurate. So this invite us to go back and look to the latest 2 years as well and see if this is a trend happening or we have improvement. But we found that we have actually improvement is starting by 2023. The improvement had been increased the number of survival rate. So this is invite us to have a further analysis for these. And we are looking now to do further analysis to see what hold the major impact in improving this survival rate. We are still going to do more analysis for this. And this study is just telling us that we need more and more and deeper analysis for this.
That was quite interesting to learn. So what can we build on from this, and how should future studies be directed?
Basically, I believe that should not be only targeting the healthcare provider. One of the factors that affecting our outcome is bystander CPR. That's mean if anyone in the street arrested and the people around them, they just do chest compression for them. This is actually very important factor on the survival rate, because unfortunately the rate of bystander CPR in our case, in our study, was only 6.6%, despite that the international standard reached up to 60%. And this 6.6%, half of them, that is 22 cases only in our study, that they have a people to do for them cardiac bystander CPR. And these people, half of them, 50% of them survived to discharge out of the hospital. No. And all of them discharged with good neurological outcome. This is just to emphasize in the importance of the bystander CPR, the importance of training the community about the chest compression and the high quality chest compression, how to provide the chest compression in a proper way. These are very important factors to educate the community, and actually very important to appreciate the whole chain of survival that AHA is always speaking about, chain of survival. So we believe this is coming from the people with recognizing the cardiac arrest, to the first and initial responder by paramedics, to the emergency departments, hospital rehabilitation. It's the whole system is telling us that, alhamdulillah, that we have a healthy system. We still can reach more and beyond. And we believe that we can reach more and beyond. But it's just telling us that we have a actually good system that we need to appreciate.
How do you think these kind of conferences can help increase this awareness, increase these efforts to increase the survival rates or the research what you are doing?
Looking for this conference and the effort of my colleagues in EHS in the critical care, they have an amazing conference actually, and we do really appreciate what they are doing. This is just a great platform for exchange knowledge, interacting intraprofessionally between different levels and different specialties, and to work. And because we start actually to have this tunnel vision of having each physician is looking for their specialty and this, but we believe that from a higher and larger perspective, such conferences and such platforms to discuss with each other and have collaborating work, will have a huger impact in the general outcome of the patient result. So we believe that this is a very great effort. We hope that we will have a further collaboration together, and we have to have this for the better outcome of the patients.
It was nice talking to you, Dr. Osama.
It's my pleasure. Thank you very much.